Hello everyone, Dr. Matt Ed, and today we'll talk about point-of-care ultrasound. Is there LV hypertrophy? Objectives are to determine if there is LV hypertrophy and to calculate LV mass. One of the formulas that can be used with a handheld ultrasound is the linear echo method, and is using the Devereux and Recheck formula. The formula gives you the LV mass in grams, and it is calculated by LV internal diameter plus LV posterior wall thickness plus interventricular septum wall thickness, all of that cubed, minus LV internal diameter cubed, times 1.04 times 0.8 plus 0.6. All the measurements are in centimeters and taken when the heart is in diastole. The measurements are obtained at the mid-ventricular level in parasternal long axis view, and the formula assumes cubic shape of the left ventricle. And because there are different LV masses depending on people's height and their body surface area, the LV mass, when it's calculated, is indexed to body surface area. And so you divide the LV mass in grams by the body surface area in meters squared. And you can use the MD calc to figure out the body surface area for a particular person. And this provides a measure of LV mass that is adjusted for the individual's body size. That way you can compare different people. LVH is often present if the interventricular septum or the LV posterior wall thickness is greater than 1.2 centimeters in diastole. But strictly speaking, one needs to calculate the LV mass to correctly say there's LV hypertrophy. Using the Devereux and Recheck formula with LV mass indexed to body surface area, and the normal values for women are 43 to 95 grams per meter squared. For men, it's 49 to 115 grams per meter squared. Here is an example. The heart is in parasternal long axis view. We have the MO line going down the mid-ventricular area. Here we have the LV internal diameter. C is the interventricular septum, and A is the left ventricular posterior wall thickness. And all these measurements are in centimeters. And these measurements are taken when the heart is in diastole. You can see that when the walls are closer together, the heart is in systole, and the walls are further apart. That's when they are in diastole. Applying the formula that we spoke about earlier, you get 125 grams, and you divide that by the body surface area, 1.63 of this particular person. This heart comes out to be 77 grams per meter squared, which is normal. So this heart does not have hypertrophy. This is my reference. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for listening.